going to start doing the 3-step peel now. We're going to start, you can see the peel is already here. It's not going to be running anywhere. We start methodologically going through the skin across both ways so that you're not missing anywhere. So you know exactly where we are when we're popping it along all. And then we're going to make sure that there's no running of it. And you're going to rub this into the skin to make sure that we're getting it into all the nooks and crannies. But we're not going to do it right round the eyes just yet. We're going to do that on the last pass only. When we get to the neck, we always have to feather the neck because you don't want a rim around the area. And then you need to reapply the product. This 3-step peel is a great treatment to add on to your home care, to give you skin tightening, anti-aging, remove lines and wrinkles, improve texture and improve pigmentation on the skin. So it's a wow treatment to have. This treatment you're going to do on your patients once a month for 3 cycles maximum. Okay, Sue? Mm-hmm. On a scale of 1 to 10, how does it feel on your skin?
About a 4.
So it's not too bad at the moment.
Not too
but
bad.
As the
It's getting
patient
hotter.
Gets more and more into the treatment, the more product we apply, the hotter it's going to get for her on her skin. Go right into the hairline. And onto the nose. Don't forget the bit in the middle there. Lots of people forget that when they're doing their facials. Okay? Mm-hmm. Do you want the fan on?
That's alright.
Yeah? Put it a bit closer to the fan as well, that's it. So you can see now it's starting to go with white in patches. Mm-hmm. That's the product that's crystallising on the skin. We're now going to switch to our next pad and we're going to do another pass of it. So you pop it in and squeeze it out thoroughly because you don't want any drips. And off we go. So we're starting at the top, going across. Now Sue hasn't got any semi-permanent makeup or anything in her brows, but if they did have, you'd avoid that area. Okay, Sue?
Yep.
On a scale of 1 to 10, how does it feel now? Is it hotter?
No, it's alright.
So you can tell that Sue's well prepped because she's able to tolerate the treatment really well. It's actually a brilliant treatment to have, and I urge you all to have one in clinic.
First pass was hotter.
The first pass was hotter, was it? Great. So you're going to use the whole vial on this face unless the patient says, stop, that's enough now, or they want a weekend peel and they don't want to be peeling lots and lots and lots. So Sue is an ideal patient today. She's coping with the treatment really well. Sometimes they have tears in their eyes, so it's important to have somebody at hand with a tissue if that happens. Or if you're working alone, then have somebody, the patient, holding a tissue themselves. So that's 2 passes. And you can see the skin reaction is brilliant. So this lady, you know, has prepped her skin amazing because there isn't any frosting or anything on the skin. So we'll now go to the final pass, final pad. And we're going to go round again, exactly in the same sequence, so it's even distribution of product. Only this time we're going to go around the eyes, on the lips. How's it feeling now, Sue?
Wow.
So it's getting hotter on her skin now as we get to the final part of the treatment. So where is this peel penetrating? Does everybody remember?
Epidermis.
Basal layer of the epidermis. So we're going to give a quick pass over the lips there so we can really help those fine lines and wrinkles on the lips. And we're going to do a pass over the eye area, gently passing it right over the lid and under the lid. So you always tell your patients to keep their eyes closed, and that's because you don't want to be causing them to cry, because it's quite a strong smell to the peel, and also it reduces any risk of you spilling it anywhere. How's it feeling now, Sue?
Red up.
Out of 10, what's the pain or the stinging like now?
Probably say about 8 or a 9. It's hot.
It just all of a sudden goes to feel really warm, but that's
Yeah.
really short-lived. As soon as we've finished application, that stops.
It's not unbearable.
And then there's a little bit left, so we're going to use all this, which is going to get amazing results on our skin. You're checking everywhere to make sure you've passed everywhere on the skin. And the last bit, you're just perfecting anywhere that you can see. So now we've finished applying the peel. The next part of the treatment, you can see now, even colour all over Sue's face. We have no frosting, only crystallization of the product. So the second part of the treatment is the retinol. So we're now going to apply a 6% retinol on the skin. Can somebody just grab a piece of that ready, just in case? You can see there's a little tear come in here.
Yeah,
And
that's
just
hot now.
dab that on her eye, and this side there, right in. You don't want anything running on the face because you're going to neutralise the peel. So you put the whole sachet on. So Sue, you're going to feel a little bit of a surge of heat on your skin now, but then we're going to put the lovely hydrating cream on after, okay? So this is your 6% retinol. So this is going to give you that second stage of skin tightening. This is going to pass through into the dermis and give you that wow result. All done now, Sue. So you've done absolutely fantastic. So would you say now it was a 10 out of 10? And again, just go there. Make sure you rub it in thoroughly and evenly everywhere. So Sue, you've been fantastic. There is the peel done. This is the nicest part of the treatment for Sue now. We're going to be applying the hydrating cream, which is really calming and soothing. And this is the final stage of the peel. So this will take the edge off that heat. Just dab again here. So has that soothed the skin,
Yeah.
Sue? So straight away when we put the hydrating cream on, that heat goes into like soothing, it feels better, and she's only going to be feeling that heat. It's only literally, it was taking us 10 minutes to do the whole treatment, hasn't it? You can dab again for me. So this part you can take more time and give them a little bit of a massage in with a hydrating cream just to ensure that they feel relaxed and soothed. And I also ask them to keep their eyes closed for a few minutes after the treatment as well. And there we have it, 3-step peel.